Podiatrist, and today we're here to discuss the do's and don'ts of diabetic foot care. We're going to focus on three major areas, which is diabetics and their skin, diabetics and their feeling, and diabetics following injuries, and how they should follow up with that. So overall, diabetics often have problems with nail discoloration or nail loosening or thickening, as well as severely dry skin. So I often tell patients when they see any of those problems, they should come and see a podiatrist sooner than later so we can diagnose what's going on. I always recommend patients to lotion their feet often, make sure it really dries in, and make sure that the lotion is not in between their toes because that can cause maceration. The second thing that happens is diabetics sometimes get what is called diabetic neuropathy, where they experience numbness and tingling in their toes that may go up their foot and ankle, or they may have a general pain or burning in their foot and ankle. So I often tell patients when they have those symptoms, they should come and see a podiatrist once more so we can actually diagnose what's going on and medications that we can prescribe to them. Because of that, patients are often told not to go barefoot. That's the first do. Do not go barefoot. Barefoot includes soft-soled shoes, socks, as well as actually being barefoot. And the reason is if patients do have diabetic neuropathy, they lose their protective sensations and they may get a cut or scratch or a nail inside their shoe that they don't know, even a bottle cap. I've had patients that's come in with a bottle cap in their foot and they didn't know it was there. So it's the first line of protection for those patients. Don't go barefoot, wear supportive shoes. The second thing goes into patients not soaking their feet. That's often a common misconception where patients at the end of the day, they want to soak their feet for a long period of time. And the reason being is that you can soak it too long and actually cause a softening of your skin, or you may not be able to gauge the temperature that it actually is. So what I tell patients is that when they're taking a shower, they should stop up the water and just stand in the water for some time while they're bathing. And prior to that, they should use their hand or their elbow to gauge the temperature of the water so that they're not at risk of developing a burn to their feet or even a cold injury, because that often happens as well. The other thing that I would like to go over is diabetics and injuries. Diabetics are just like us, they're active patients, and sometimes they get sprains or they twist their ankle or they drop something heavy on their foot. And they may not know that they actually have a worse injury than what they think it is. So I tell my diabetic patients if something like that ever happens, call up your podiatrist, let them know it happened, and they should see you within 24 to 48 hours. And if it's a major injury like a laceration or a real fracture, of course go and see your emergency department so that they can take care of that. Diabetic patients should also look at their feet on a regular basis. So the best time to do that is after you get out of the shower. Here we have a magnifying glass which extends like this. You can purchase this from any drugstore, and she can demonstrate how easy it is to look at the bottom of your feet. This should be part of your daily routine, just like brushing your teeth. So you should keep it in your medicine cabinet. After you get out of the shower, dry your feet thoroughly, dry in between your toes, and look at your feet really well. And the importance of that is that if you do have a cut or a scrape or a blister or anything that looks abnormal, you can see it first and call your local podiatrist to come and get it checked out. So the take-home message is that anything that looks suspicious in terms of the health of your feet should be evaluated by a podiatrist as soon as possible. Don't treat anything yourself. It's always best to have a doctor that treats it. So those are my tips and pearls for diabetics and their feet. Once again, I'm Dr. Edugie Omoregbee. I'm a podiatrist at Kennedy University Hospital. Kennedy offers comprehensive diabetic classes. More information can be reached at kennedyhealth.org/diabetes.